Today I want to talk about serotonin syndrome, which is a potentially life-threatening condition that's basically a drug reaction caused by taking multiple medications that act on the neurotransmitter serotonin. So I want to talk a little bit about what it is, what the signs and symptoms are, which medications have been implicated, and who's at the highest risk for getting this syndrome. Now, serotonin syndrome is very rare, and it hardly ever occurs when you're using just one medication that can cause it. But it becomes more common as you add more medications to the mix that increase serotonin activity. Now, it can be a life-threatening situation, so it's very important that you identify if you're at risk for it and that you know how to identify signs and symptoms so you can notify your doctor immediately.
Today I want to come to you with the technicality of the gut-brain connection. I've done videos before on the gut-brain connection, its correlation with serotonin, benzodiazepines, painkillers, your immune system, how all these things are housed in what's called your enteric nervous system. So as Metchnikoff said in the early 1900s, fix your gut, fix your health, and that death begins in the gut.
Serotonin syndrome is usually classified with a couple different disorders, and the first is going to be musculoskeletal disorders, which commonly present as muscular rigidity, kind of rigid movements, uncontrollable muscle movements, and even arresting tremors sometimes, uncontrollable, shaking. Those can be a big clue. Also, we see some mental status changes, so if you become confused, any hallucinations, or even agitation, these can all be signs of serotonin syndrome as well. And the last and usually most severe presentation is going to be an autonomic disorder. That's usually kind of a hyperactive response of the body. You might get some increased temperatures. In fact, often when serotonin syndrome is fatal, it's due to very severe fevers. There's been reports of fevers up to 107 degrees and above.
How it's produced. So if you look at this picture in front of you, now this is a picture of your small intestine basically, and what you're looking at is what are called the EC cells, the enterochromaffin cells. Now a lot of this stuff is technical, but the bottom line is you need to know function in order to know dysfunction. So what happens when we eat food? We eat it, goes into the mouth, which has to be an alkalinic pH, goes down the esophagus, through the cardiac sphincter into the stomach, which has to be acidic pH. You have pepsin, HCl, on and on. It makes its way to the small intestine, which is a alkalinic pH. Now, when it makes it to the small intestine, that acidity signals certain enzymes.
These are also common presentations as well. Medications that can usually cause this are, for one, antidepressants. Most antidepressants increase serotonin activity. So those are usually the base of the cause of serotonin syndrome. So when you start adding multiple medications in the mix, that's when you start to see it. And a lot of people don't think about other medications that can cause increased serotonin as well that are outside of the antidepressant class. And this can be some pain medications like methadone or tramadol or pentazocine. It includes muscle relaxants like Flexeril, medications like Buspar, and medications used to treat acute migraines, the triptans, which includes Imitrex and Maxalt, and other drugs in that class as well.
Serotonin syndrome.
I like to think of serotonin syndrome as a spectrum of disease. It can sometimes be as mild as a little tachycardia, which means your heart rate's going a little fast, a little sweating. You can also move into a full-blown serotonin syndrome, which is essentially life-threatening and sometimes is associated with hyperthermia, meaning your temperature is way above normal.